Hello students and friends. Today in this homeopathic materia medica lesson, I will discuss about homeopathic medicine Capsicum annuum. Before start this video, please subscribe to this channel. We need support from you to make this channel more beautiful. Capsicum annuum seems to suit especially persons of lax fiber, weak, diminished vital heat. A relaxed plethoric sluggish, cold remedy. Not much reactive force. Such persons are fat, indolent, opposed to physical exertion, averse to go outside of their routine, get homesick easily. General uncleanliness of body. Abstainers from accustomed alcoholics. It affects the mucous membranes, producing a sensation of constriction. Inflammation of petrous bone. Burning pains and general chilliness. Older people who have exhausted their vitality, especially by mental work, and poor living, blear-eyed appearance, who do not react. Fear of slightest draught. Marked tendency to suppuration in every inflammatory process. Prostration and feeble digestion of alcoholics. Myalgia, aching and jerking of muscles. Mind, excessive peevishness. Homesickness, with sleeplessness and disposition to suicide. Wants to be let alone. Peppery disposition. Delirium tremens. Head, bursting headache, worse, coughing. Hot face. Red cheeks. Face red, though cold, acephalate. Ears, burning and stinging in ears. Swelling and pain behind ears. Inflammation of mastoid. Tenderness over the petrous bone. Extremely sore and tender to touch, onosmod. Otoria and mastoid disease before suppuration. Throat, hot feeling in forces. Subacute inflammation of Ustachen tube with great pain. Pain and dryness in throat extending to the ears. Sore throat of smokers and drinkers. Smarting in, constriction. Burning constriction worse between acts of deglutition. Inflamed uvula and palate. Swollen and relaxed. Mouth, herpes labialis, apply 1 drop of the mother tincture. Stomatitis. Disagreeable smell from mouth. Fetid odor from mouth. Stomach, burning in tip of tongue. Atonic dyspepsia. Much flatulence, especially in debilitated subjects. Intense craving for stimulants. Vomiting, sinking at pit of stomach. Much thirst, but drinking causes shuddering. Stool, bloody mucus, with burning and tenesmus, drawing pain and back after stool. Thirsty after stool, with shivering. Bleeding piles, with soreness of anus. Stinging pain during stool. Urine, strangery, frequent, almost ineffectual urging. Burning in orifice. Comes first in drops, then in spurts. Neck of bladder spasmodically contracted. Ectropion of metis. Male, coldness of scrotum, with impotency, atrophied testicles, loss of sensibility in testicles, with softening and dwindling. Gonorrhea, with chordee, excessive burning, pain in prostate. Female, climacteric disturbances with burning of tip of tongue, lethaires. Uterine hemorrhage near the menopause, with nausea. Sticking sensation in left ovarian region. Respiratory. Constriction of chest, arrests breathing, hoarseness. Pain at apex of heart or in rib region, worse touch. Dry, hacking cough, expelling an offensive breath from lungs. Dyspnea. Feels as if chest and head would fly to pieces. Explosive cough. Threatening gangrene of lung. Pain in distant parts on coughing bladder, legs, ears, etc., extremities, pain from hips to feet. Sciatica, worse bending backward, worse, coughing. Tensive pain in the knee. Fever, coldness, with ill humor. Shivering after drinking. Chill begins in back, better, heat. Must have something hot to back. Thirst before chill. Modalities, better, while eating, from heat. Worse, open air, uncovering, drafts. Most of the substances that are used on the table as seasoning in foods will in the course of a generation or two be very useful medicines, because people poison themselves with these substances, tea, coffee, pepper, and these poisonous effects in the parents cause in the children a predisposition to disease, which is similar to the disease produced by these substances. In the fat, flabby, red-faced children of beer drinkers and pepper eaters, with poor reaction, a relaxed and flabby constitution, red face and varicose condition, those that have been overstimulated, children of overstimulated men, we find the sphere for capsicum very often. In those constitutions in which the face looks rosy, but it is cold or not warm, and upon close examination the face is seen to be studded with a fine system of capillaries. Plump and round, with no endurance, a false plethora like California. The end of the nose is red. The cheeks are red, redness over the cheeks, red eyes, easily relaxed individuals. These constitutions react slowly after diseases and do not respond to remedies, a sluggish state, a tired, lazy constitution. In schoolgirls who cannot study or work, who get homesick and want to go home. In gouty constitutions, with cracking of the joints and gouty deposits in the joints, stiff joints, clumsy, weak, give out soon. There is sluggishness of the whole economy. They are chilly patients, are sensitive to air, and want to be in a warm room. Even in the ordinary weather the open air causes chilliness. They are sensitive to cold and to bathing. In the mental state there is no more striking thing than this symptom, homesickness. A sickness like homesickness runs through the remedy and is accompanied by red cheeks and sleeplessness, hot feeling in the forces, fearfulness. They are oversensitive to impressions, are always looking for an offense or slight, always suspicious and looking for an insult. Obstinate to the extreme, it is a devilishness. Even if she wants a certain thing she will oppose it if it is proposed by someone else. After emotions red cheeks, yet with the red cheeks lack of heat, even with increased temperature, or one cheek pale and the other red, or the cheeks alternately red and pale. Children are clumsy and awkward. The capsicum mind is almost overwhelmed by persistent thoughts of suicide. He does not want to kill himself, he resists the thoughts and yet they persist, and he is tormented by these thoughts. There are persistent thoughts in many remedies, and it is necessary to distinguish between impulses and desires. If he desires to have a rope or a knife to commit suicide, that is altogether different from an impulse to commit suicide. An impulse is sometimes overwhelming and overbalances the mind, and he commits suicide. You should always find out from a patient whether he loathes life and wants to die, or if he has impulses which he wishes to put aside. Some persons lie awake at night and long for death, and there is no reason for it. That is a state of the will, insanity of the will. In another patient the thoughts jump into his mind and he cannot put them aside, and the thoughts are tormenting. The distinguishing feature of the remedy is often found by differentiating between the two. Desires are of the will, impulses come into the thoughts. Headaches as if the skull would split when moving the head, when walking or coughing. Feeling as if the head would fly to pieces, holds the head with the hand. Feeling as if the head were large, aggravated by coughing and stepping, ameliorated by lying with the head high. Bursting pain and throbbing. Headache with pulsation in the forehead and temples. Headache as if the brain would be pressed through the forehead. On stooping, feeling as if the brain would be pressed out, as if the red eyes would be pressed out on stooping. The senses are disturbed and are over-acute, oversensitiveness to noise, smells, taste and touch, to impressions, to insults. The patient is excited. Pains in the ears, itching pain, aching, pressing pain with cough, as if an abscess would burst. It has a peculiar action on the bones of the internal ear and mastoid process. Abscess is round about and below the ear and carries, petrous portion of temporal bone neck roast. It has been a frequently indicated remedy in mastoid abscess. Old catarrhs. The patient takes cold in the nose and throat and this is followed by a collection of mucus. Very often in stupid patients it is difficult to get symptoms, and you must depend on what you see, the character of the discharge and a few other things, and you will find that some of these cases will be cured and all the other symptoms will go away. But in some of these old catarrhs no reaction seems to come after the most carefully chosen remedies, and all at once the doctor observes that the patient has a red face and it is cold and the end of the nose is red and cold, and the patient is fat and flabby and yet has not much endurance, never could learn at school, and if she exerts breaks out into a sweat and freezes in the cold air. He has a key to the patient and examines the patient by the key, that is, by the drug. A bad practice and never to be resorted to except as a dernier resort and in stupid patients. When he gives capsicum to that patient it arouses her, it may not cure, but after it the silicea or calibic, or other remedy which was perhaps given before and did not act takes hold and cures. In the text it says, nose red and hot. The skin all over is red and burning, a capillary congestion. The cheeks are red and hot, and this alternates with paleness. Red dots on the face. Pains in the face like bone pains, from external touch. Pains are worse from touch. Pain in the zygoma, or the zygoma is sensitive. Sensitive to pressure over the mastoid. Swelling in the region of the mastoid. Taste foul like putrid water. When coughing the air from the lungs causes a pungent offensive taste in the mouth. A hot pungent air comes up from the throat, tasting foul when coughing. On the tongue and lips, flat, sensitive, spreading ulcers with lardaceous space. The mucous membrane of the lips and various parts of the body if pinched up with the fingers remain in the raised position, showing a sluggish circulation. This is the flabbiness of capsicum. It wrinkles on pressure. It is a feeble circulation. The parts you touch are loose and flabby, red, fat and cold. That child will not react well if it has measles, until it gets capsicum. The skin is moist and cold, and there is a fine measly condition of the skin due to capillary congestion. If the child is old enough it will complain of feeling cold. There is slow reaction after eruptive diseases, after glandular diseases, after bowel complaints. The child was fat and flabby, but now does not take on flesh. He takes cold in the throat and nose, and the throat looks as if it would bleed. It is so red, a fine rash-like appearance. It is puffed, discolored, purple, mottled, flabby and spongy looking, dark head. Burning soreness with ulceration in the fauces. Uvula elongated. Stitching in throat. Enlarged tonsils, inflamed, large and spongy. The throat remains sore a long time after a cold or sore throat. Burning, pressing pain in the throat dark red, relaxed sore throat, pain on swallowing, dysphagia. Throat sluggish for weeks, a do-nothing state. Does not get very bad, but gets no better, a lack of reaction. When the chill begins there is thirst. Thirst after every dysenteric stool, a sudden craving for ice-cold water, which causes chilliness. Craving for water before the chill, and when taken it hastens the chill, it feels cold. In the stomach. He desires something warm, something stimulating, craves pungent things. This is seen in whiskey drinkers. They crave pepper, and the pepper, on the other hand, turns round and craves whiskey. These diffusible stimulants crave some stimulating thing, crave support. Dipsomania. Let me give you a hint in arsenic. In dipsomania the sinners who have been drinking a great many drinks in a place sometimes get to that state in which they must get up during the night for a drink, or they will not be able to get up in the morning. In the morning the first 3 or 4 drinks will be thrown up, but the next one will stay down. They must take a number until one sticks. They have got to that state in which they must keep on taking it. If they sleep too long the first few drinks will come up, and so they must get up in the night, or the whiskey will not stay down in the morning until they have taken a number of drinks. You will see this in lawyers who do a great amount of work on stimulants. Nox, Rs, and Caps will do something for them if they will cooperate with you. I remember saying to one old toper, who had kept up altogether, on champagne, that he would have to stop it. He whined, "I don't think it is worthwhile." If he could not get his champagne, He didn't think life worth living. If these people want to get benefit, they must cooperate. Dysentery. After stool, tenesmus and thirst, and drinking causes shuddering. Smarting kind burning in anus and rectum. Violent tenesmus in rectum and bladder at the same time. Hemorrhoids protruding, smarting, burning, smarting like pepper, they sting and burn as if pepper had been sprinkled on them. Tenesmus of the bladder, strangery. Burning, biting pain after urination. In old cases of gonorrhea, in which there is no reaction, the discharge is creamy. You take a picture of his face, you notice the plethora, but also that he has no endurance, plump, flabby, sensitive to cold, red face. He does not react after cold. He has the last drop or a creamy discharge with burning on urination. Capsicum will sometimes stop it suddenly. Coldness of scrotum. Prepuce swollen, edematous. Pain in the prostate gland after gonorrhea. Coldness of the affected part. Coldness in patches. Coldness of the whole body. It is useful in perplexing and troublesome chronic hoarseness. He has had a cold and remedies for the acute condition have been given, perhaps 2 or 3 remedies, acan, brie, hep, fos, but all at once you wake up to the fact of his chronic constitutional state of hoarseness. He is rotund, chilly, red-faced, and the hoarseness disappears under capsicum. It is the same with the cough. After making several blunders you wake up and see it is a capsicum case and that you have never yet gotten at the root of the trouble. This shows the importance of getting at the things general first. If there is much acute suffering, of course you must give an acute remedy, but if the patient has delayed recovery and convalescence is slow, the next remedy should be the remedy for the patient. Sometimes it is salve, fos, like, and sometimes it is caps. If the patient has a good constitutional state he will get over the cold on the acute remedy, but the old gouty, rheumatic, flabby patients need a constitutional remedy. Cough in sudden paroxysms, convulsions the whole body, cries after the cough from the headache. Stitches in the suffering part with the cough. Every cough jars the affected joint. The constitutional state comes first and the particulars must agree, i.e., prescribe according to the totality. Thanks for watching this video. For more updates please subscribe this channel and press the bell icon to learn homeopathy course online. Have a nice day.